Hi, this is Josh, pharmacist with pharmacisttips.com, here with part 2 of the most common medications, the top 100 prescription drugs. Part 2 will include the medications Citalopram, Insulin Glargine, Montelukast, Trazodone, Pantoprazole, Escitalopram, Pravastatin, Bupropion, Fluoxetine, Carvedilol, Prednisone, Tamsulosin, Potassium, Clopidogrel, Ibuprofen, Meloxicam, Rosuvastatin, Aspirin, Tramadol, and Zolpidem. The top 100 list I did get from the ClinCal website. I'll include a link to that in the video description, as well as specific times of each medication in case you'd like to jump ahead to a specific one. As with all my videos, all the information in this video is for informational purposes only. It's not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. Number 21 is Citalopram. Citalopram is an SSRI, or selective serotonin reuptake inhibitor. Of course, that's an antidepressant. In the US, it is sold under the brand name Celexa. It is indicated for use in depression, OCD, and panic disorder. It is available in 10, 20, and 40 milligram tablets. There's an oral solution available as well. Typical doses are 20 to 40 milligrams taken once per day. Some side effects can include headache, dizziness, insomnia, constipation, nausea, dry mouth, drowsiness, excessive sweating, fatigue, impotence, agitation, anxiety, tremor, serotonin syndrome, as well as certain heart problems. Important things to remember with citalopram: you want to watch for thoughts of suicide, and especially when the medicine is first started. It is best to be tapered. If you've been on this medication for a considerable amount of time, it is best to slowly decrease the dose over time rather than stop cold turkey. Full benefit may take several weeks. It could take up to 6 weeks to notice the full benefit of this medication. And we want to avoid alcohol, NSAIDs, and aspirin. NSAIDs are like ibuprofen, Aleve, Motrin. Those increase the risk of bleeding if you're taking the medication citalopram. Number 22, Insulin Glargine. Insulin Glargine is available in several products, including the Basaglar Quick Pen, the Lantus and Lantus Solostar, Toujeo Max, Solostar. It is a long-acting insulin, typically dosed once a day. Sometimes the larger doses are split up, and for whatever reason you may see a provider want to split up the dose, but typically once a day. It, of course, is used to control blood sugar in diabetics. Some side effects we can see with the insulin Glargine include weight gain, which we can see with all insulin, fluid retention. Of course, if the dose is too high or if we're not eating, we can get low blood sugar. Diarrhea can occur. And of course, we need to watch out for allergic reaction. Other key points is to remember is, of course, we're going to monitor blood sugar if we're using injectable insulin. Educate on the symptoms of low blood sugar, which generally includes nausea, sweating, tremor, and when it's really bad, loss of consciousness. Always store the insulin properly, and be sure to rotate injection sites. Number 23, Montelukast. Montelukast, sold under the brand name Singulair in the US. Of course, it's indicated for asthma. It's also indicated for exercise-induced bronchoconstriction, seasonal allergies, and rhinitis. It's a leukotriene receptor antagonist. The tablets are available in 10 milligrams, chewables available in 4 and 5 milligrams, and a granule packet available in 4 milligrams. Side effects can include drowsiness, rash, dizziness, liver problems, headaches, indigestion, behavior changes, and suicidal thoughts. The FDA has added a black box warning for those suicidal thoughts, aggression, agitation, depression, changes in sleep, again, those suicidal thoughts. And so the risk-benefit needs to be evaluated. It isn't recommended as first-line treatment for a lot of conditions anymore. This does seem to affect children and young adults most, so certainly something to consider when this medicine is being started. Number 24, Trazodone. Trazodone, US brand name Desirel, available in tablets 50, 100, 150, and 300 milligrams. It is an antidepressant. Of course, that's used to treat depression, but by far the most common use is the off-label treatment of insomnia or difficulty sleeping. Side effects can include headache, nausea, drowsiness, dizziness, dry mouth, backache, blurred vision, constipation, diarrhea, low blood pressure, bleeding problems, heart rhythm issues, serotonin syndrome, and thoughts of suicide. We see that listed on all the antidepressants. Um, Key points with Trazodone: watch for improvement or worsening of symptoms. Want to be really cautious during activities requiring alertness. Even the next day, we want to monitor heart and liver. Avoid alcohol is a good idea with all antidepressants. And food improves the absorption of Trazodone. Important. Some people find if they take it with a snack at bedtime, seems to help them sleep through the night just a little bit better than if they took it on an empty stomach. 25. Pantoprazole. Pantoprazole is a proton pump inhibitor sold under the brand name Protonix in the U.S., indicated for GERD, erosive esophagitis, and other what we call stomach or esophagus issues, Zollinger-Ellison syndrome, H. pylori in combination with antibiotics. Tablets are available in 20 and 40 milligrams. Side effects can include stomach pain, diarrhea, headache, flatulence. We can rarely see a severe skin rash. Increased risk of fractures, muscle damage, and kidney problems can occur. Couple key points here with pantoprazole. Always want to use the lowest effective dose for the shortest duration. Remember, proton pump inhibitors are usually only indicated for 6 to 8 weeks. This one can be taken with or without food, so there's a little more flexibility in dosing in compared to other the proton pump inhibitors. Of course, we always want to watch for side effects. Escitalopram, number 26, Escitalopram. Escitalopram is a SSRI, selective serotonin reuptake inhibitor. In the U.S., sold under the brand name Lexapro. Tablets are available 5, 10, and 20 milligrams. Oral solution available as well. Generally, adults are started on 10 to 20 milligrams once a day. Used for depression, generalized anxiety disorder, OCD, hot flashes, panic disorder as well. Some side effects can include drowsiness, headache, nausea, constipation, diarrhea, excessive sweating. Sexual dysfunction can occur with many of the antidepressants. Weight gain, serotonin syndrome, suicidal thoughts, issues, heart rate issues, and increased risk of bleeding, especially when combined with other medications. Some key points with escitalopram. Of course, we want to monitor that the symptoms are improving. We want to be certain that we're not having thoughts of suicide. Full effect may take weeks, like the other antidepressants. Watch for that abnormal bleeding. Monitor electrolytes. We need to avoid alcohol with antidepressants, as well as NSAIDs. NSAIDs being ibuprofen, naproxen, that sort of thing. That increases the risk of bleeding. If you've been on this a considerable amount of time, cold turkey usually not the best way to stop, as it generally needs to be tapered. Number 27, Pravastatin. Pravastatin, number 27. Pravastatin is a HMG-CoA reductase inhibitor, what we like to call statin. Brand name Pravachol, used to treat high cholesterol, high lipids. It's used to prevent blockage in the arteries. Dosages are 10, 20, 40, and 80 milligram tablets. Side effects can include headache, heartburn, nausea, increased liver enzymes, muscle pain and damage, rash, severe muscle damage, and tendon rupture. So we can sometimes just get mild muscle pain, but then with the statins, we can get that severe muscle pain. Pravastatin does seem to be a little bit less than some of the other statins in the incidence of that. Other key points, of course, we're going to monitor cholesterol, want to monitor liver functions and signs of muscle damage. Typically, best taken in the evening. Of course, statins are not used during pregnancy. We'll want to avoid excess alcohol when we're on statins. And there is some question as to whether statins increase the risk of developing diabetes, as they can increase blood sugar. That is something hopefully we will find out more over the years as long-term studies are coming out. Number 28, Bupropion, sold under the brand name Wellbutrin, Zyban, and others. It is available in immediate release as well as extended release tablets. It's a monocyclic antidepressant that has effects on dopamine and norepinephrine. It's indicated for depression and seasonal affective disorder. Zyban, of course, is indicated for smoking cessation. Some side effects can include dry mouth, constipation, nausea, headache, dizziness, difficulty sleeping, tremor, increase in heart rate, agitation, rash or itchiness, high blood pressure, and of course, suicidal thoughts are a risk with all the antidepressants. So we want to monitor, of course, for symptoms, make sure the medicine is improving like we expect, and if it's not, change to a different medication, get some medical help there. Full benefit may take weeks, as with all the other antidepressants. Want to monitor heart rate as well as blood pressure. It can increase risk of seizures, so people with a history of seizures, this may not be a medication for them. And we want to avoid using alcohol while on this medication. Number 29, fluoxetine. Fluoxetine, another SSRI, of course, an antidepressant. U.S. brand name Prozac. Capsules are available 10, 20, and 40 milligram tablets as well as capsules. Indicated for depression, OCD, panic disorder, premenstrual dysphoric disorder, bulimia, post-traumatic stress disorder, and fibromyalgia. Fluoxetine side effects can include nausea, diarrhea, headache, insomnia, dry mouth. Insomnia, I must have thought that was important, put it in there twice. Change in appetite, anxiety, abnormal bleeding, sexual dysfunction, weight change, serotonin syndrome, heart rate problems, and suicidal thoughts, like we've discussed with the other antidepressants. So we want to, of course, monitor for improvement or suicidal thinking. We want to watch for abnormal bleeding. Again, avoiding alcohol and NSAIDs. Benefit may take weeks. And again, you may need to taper, although fluoxetine does have a longer half-life than some of the others, and some people are able just to stop it if needed. Carvedilol, number 30, Carvedilol. Carvedilol, available in the U.S. under the brand names Coreg and Coreg CR. It's a beta blocker with alpha blocking activity. We see it used for heart failure, for high blood pressure, impaired left ventricular function after a heart attack, post-MI. Tablets available in 3.125, 6.25, 12.5 milligram, and 25 milligram tablets. ER capsules available 10, 20, 40, and 80. Some side effects that can occur, of course, dizziness, fatigue, low blood pressure. We can have cold in the extremities, fingers and toes, weight gain, joint pain, diarrhea. Want to monitor, we could see an increase in blood sugar. Nausea and vomiting can occur. Difficulty breathing, liver problems, and a severe rash. That would require medical attention if we get a full body severe rash. Other important things to remember, we want to monitor heart rate as well as blood pressure. We want to make sure this is working. Again, we talked about the blood sugar effect. We want to monitor that. We want to make sure it doesn't worsen any breathing or asthma symptoms. It's typically best with food or milk, and you'd want to taper this. You wouldn't want to stop this one cold turkey if you've been on it for a while. Prednisone, number 31, prednisone. Prednisone, it's an adrenal glucocorticoid steroid, or what a lot of people, we just say steroids. Doctor put me on steroids. It's available in tablets and liquids, used in a laundry list of conditions, allergic states, skin disorders, rashes, things like that, endocrine disorders, GI diseases, neoplastic diseases, respiratory diseases, rheumatic disorders, croup, and many, many more. Steroids like prednisone, they just have a potent anti-inflammatory effect, so they can help with all sorts of different things. Dosage varies widely, so I'm not going to even go into the different doses used here, but a lot of times we see bursts or tapers for acute conditions. 3 days, 5 days, up to a week usually. It seems like different providers have different preferences, but short-term bursts and tapers for acute conditions like coughing or allergic reactions, things like that. Daily for chronic conditions, and sometimes we even see just a one-time dose, a large one-time dose, sometimes used for acute conditions. Side effects, the side effects are generally mild when short-term. Long-term use, though there are a laundry list of side effects. Stomach upset can occur, so best with food. We want to monitor blood pressure. Thinning of the skin can occur with long-term use. Depression, euphoria, high blood sugar. So diabetics really need to monitor their blood sugar. If they're on a short-term burst, the sugars are going to be high. And of course, there's increased risk for certain infections, more of a concern with the folks using this long term. Other key points, as I mentioned, take with food. It's best taken early in the day, taken late in the day. It can make it difficult to sleep at night. Again, we need to keep an eye on the blood sugar. In long-term use, get checked for osteoporosis. And taper, the taper is generally only required if you're taking it longer than a couple weeks. Tamsulosin. Tamsulosin, alpha-1 blocker in the U.S. sold under the brand name Flomax. It's used for the prostate. It's used for bladder obstructions. It relaxes the smooth muscle in the bladder and the prostate, used to improve urine flow. Off-label, it's used for kidney stones. So occasionally you will see it prescribed for females, and when they have a kidney stone or sometimes other urinary issues as well. Dosage typically going to be the 0.4 to 0.8 milligrams daily, dosed 30 minutes after the same meal each day. Most people, that's after the evening meal, and the capsules are intended to be swallowed whole. Side effects we want to watch for is dizziness, vertigo, headache. It can cause some sexual dysfunction, abnormal ejaculation, stuffy, runny nose, swelling, low blood pressure, fatigue, and drowsiness. You need to be cautious in people who have normal blood pressure when started on this, as it can cause that blood pressure to go low, making them feel faint or dizzy. Again, the same time each day, and we want to monitor that blood pressure and watch out for that dizziness. And especially when you go from sitting to standing, it can make you lightheaded and increase the risk of falling over. If you're using it for a kidney stone, it is typically stopped once the stone is passed. Potassium, number 33. It's an electrolyte. It's used for low potassium hypokalemia. Dosage forms all sorts: injectable, tablet, capsule, powder, oral solution. Typically tablets and capsules are the most common seen in the outpatient pharmacy. Dosage varies. It's going to be based on how low on potassium you are, based on labs, anywhere from 10 to 100 milliequivalents per day. Larger doses are going to be divided up. Some tablets are not to be crushed. Some can be. It all depends on the type of tablet. So you need to be certain if your tablet is able to be crushed or not. Side effects can include nausea, indigestion, flatulence, vomiting, and of course, if you get your dose too high, it can cause high potassium. It's important to take it with food, and of course, we need regular labs to make sure the dose is appropriate. Clopidogrel, number 34, Clopidogrel. It's an antiplatelet agent. It's used to prevent blood clots. In the U.S., sold the brand name Plavix. And so that reducing the blood clots to reduce the risk of heart attack and stroke. The usual dose, 75 milligrams a day. Sometimes there is a loading dose of 300 to 600 milligrams, the first dose. After certain stent procedures and things like that, they will give an initial large dose and then go to the 75 milligrams daily. Side effects can include headache, backache, stomach upset. High blood pressure can occur, itching, joint pain. Rarely we can see some GI bleeding as well as severe rash. We always want to watch for signs of bleeding and talk to our healthcare provider right away if we notice that. We don't want to stop that abruptly. Stopping it abruptly could put you at risk of heart attack and stroke due to a clot. And it may need to be discontinued prior to surgery or procedures. They can generally will switch you over to something else to reduce the risk of clots during that time period. Number 35, ibuprofen, number 35. Ibuprofen is an NSAID, non-steroidal anti-inflammatory drug. It's sold under the brand name Advil, Motrin, and it's included in many different over-the-counter preparations as well. It's used to treat fever, headache, joint pain, arthritis pain, and all sorts of other pain and inflammation-related issues. Dosage varies. It's usually taken 3 to 4 times a day. Over-the-counter is available in liquids, 100 milligram and 200 milligram tablets. Prescription at the higher dose of 4, 6, and 800 milligram tablets. Typically, we're going to want to take that with food or milk, as it can be hard on the stomach. Side effects of ibuprofen. When used short-term, they're actually mild. Most people tolerate it really well if it's only used for a few days or a week. Other side effects we can see are swelling, itching, rash, stomach upset. While again, it's best dosed with food, ringing in the ears. When we get into using this long-term, we have to worry about stomach bleeding, bleeding ulcers, things like that. Kidney and heart problems can develop, especially if we're using it long-term. And we need to watch things like blood pressure. We can see an increase in blood pressure when this is used long-term as well. So again, that long-term use, long-term use can increase risk of heart attack and stroke, and especially high-risk individuals, even like people who've had a heart attack recently. They generally, it's not recommended that they use any of the NSAIDs. They'd want to speak to their healthcare provider before they use an NSAID like ibuprofen. Want to watch out for the stomach bleeding. Of course, we want to use the lowest effective dose for the shortest amount of time, and we don't want to use it with other NSAIDs. We don't want to use it with like naproxen or meloxicam, as that will increase the risk of side effects. Meloxicam, here another NSAID, meloxicam number 36. Again, it's an NSAID sold under the brand name Mobic in the U.S. It's used for osteoarthritis, rheumatoid arthritis, gout, as well as other pain and inflammation type situations. Dosage. It's available in 7.5 and 15 milligram tablets, and is dosed once a day. So either 7.5 or 15 milligrams once per day, taken with food or milk. Side effects can include some stomach upset, swelling, rash, itchiness, ringing in the ears, stomach bleeding. Kind of same story as the other NSAIDs. We need to watch out that we don't have any increase in blood pressure, heart or kidney issues. Those are usually not something we see in the short term, but when we get to taking this long term, many people are able to take this long term without issue, but we just need to watch for those things. Again, a lowest effective dose, shortest amount of time. Don't use with other NSAIDs. And always we want to monitor for side effects. Rosuvastatin, number 37, Rosuvastatin. Rosuvastatin HMG-CoA reductase inhibitor, another statin. Sold under the brand name Crestor, used for hyperlipidemia, high cholesterol, and use it to prevent cardiovascular disease. Dosage, it is available in 5, 10, 20, and 40 milligram tablets. Typically, people start 10 to 20 milligrams a day, max dose around 40 milligrams a day. Sometimes we see it even used every other day, or I've even seen it like 3 days a week. It does have a long half-life, and some people who cannot tolerate statins can tolerate it at that lower dosage. Side effects. As with other statins, we need to watch out for the muscle and joint pain, diarrhea, stomach pain, indigestion, constipation. We want to monitor liver enzymes, can cause sore throat and stuffy runny nose. And again, as with the other statins, the rare muscle damage and tendon rupture can occur. A few key points. Remember, dietary and lifestyle changes should be stressed more. That's something we don't spend enough time on. That you can have a tremendous improvement on your cholesterol and overall cardiovascular health by eating a little better and getting a little more exercise. Regular labs for checking cholesterol and liver functions. Want to avoid alcohol when we're on statins. Statins should never be used during pregnancy, and statins may increase the risk of developing diabetes, as we can see blood sugar creep up when you're on a statin. Number 38, aspirin. Aspirin is acetylsalicylic acid. Sometimes you see it abbreviated as ASA. Numerous over-the-counter preparations with aspirin in it. It's of course used for pain and inflammation. It's used for fever, and it's used to reduce the risk of heart attack and stroke, as well as other uses. Dosage all across the board for pain and inflammation, generally 325 milligrams every 4 to 6 hours. We see 81 to 325 milligrams once a day in effort to reduce risk of heart attack and stroke due to blood clots for certain conditions. Side effects, dizziness, fatigue, insomnia, rash, stomach irritation can occur with aspirin, kind of like the NSAIDs. It can cause that same sort of stomach irritation, heartburn, anemia, and other side effects. 39, Tramadol. Tramadol is an opioid analgesic. It's sold under the brand name Ultram in the United States. Of course, that's used to treat pain. We see it used off-label for restless leg syndrome as well. IR immediate release tablets are available in 50 milligrams. Extended release tabs 100, 200, and 300, and there's an extended release capsule available in 100, 150, 200, and 300. Typically, we're going to see it dosed 50 to 100 milligrams of 1 or 2 tablets every 4 to 6 hours, maxing out at 400 milligrams per day. Tramadol side effects can include constipation, stomach upset, dizziness, drowsiness, sweating, itching, dry mouth, difficulty breathing, as well as physical dependence. All the opioid analgesics, we do have a risk if we continue to take them. As the pain decreases, we can become physically dependent on them, as well as in other situations. So ideally, we want to use the lowest effective dose for the shortest amount of time possible to reduce that risk. Other key points with Tramadol, we want to treat constipation. If you're using it for more than a day or two, we have to worry about it causing constipation. Need to use extreme caution when alertness is required. We do not want to use alcohol with Tramadol, and we want to avoid using it with other sedating medications, sleeping medications, things like that. The two together can cause extreme difficulty breathing or even death. And doses may need to be tapered if you've been on it a few weeks, few months. Typically, most folks are going to be pretty uncomfortable going cold turkey, and it needs to be tapered down. Zolpidem, number 40, last drug here in part 2, Zolpidem. It's a non-barbiturate hypnotic. So my sleeping pill is how a lot of people refer to it. My sleeping pill, sold under the brand name Ambien. It's of course used to treat insomnia. Dosage, it's available in an immediate release tablet, 5 and 10 milligrams. ER tabs are available in 6 1/4 and 12.5 milligram. It's 1 tablet immediately before bedtime. This is taken right at bedtime, never in the middle of the night, sort of wake up and trying to get back to sleep, as it will carry over into the next day. Best taken on a short stomach, and it is indicated to be only used short term, 7 to 10 days, although that's rarely the case, unfortunately. I mean, people need sleep, and this medicine does work for them. Side effects can include, of course, drowsiness and dizziness, confusion and blurred vision. It can cause sleepwalking or sleep eating. Some people will wake during the night and not remember it. So you need to make sure your household contacts are aware of that could occur, and let you know if it's happening. Depression, of course, dependence. We can become dependent. It's hard to sleep without it after you've been using it a while. Increased risk of falling, as with all the hypnotics. We've got to be careful that it could make you unsteady and you could fall. Again, you want to avoid alcohol with Zolpidem. You could stop breathing and die, essentially. The same thing with opioids. We have to be careful. It could cause respiratory depression. Long-term use, again, can result in dependence. We need to use extreme caution when alertness is required. So we need to be very careful the next morning. Make sure that we are fully awake before we engage in activities requiring alertness. And they are now recommending, they've found that women metabolize or process the medicine slower, and they've determined that the lower doses are generally more appropriate to prevent daytime drowsiness the next day when used by females. Appreciate you watching. If you appreciate videos like these, please like and subscribe.